I was so impressed when I first started working with you at how competent you were with how many different systems, right? And I think you have to be when, just like you're saying, you are truly treating the whole person, but you have to be really good with your endocrine, and you have to be really good with your autoimmune stuff, and really good with your gut. And you have to have all of sort of like kind of everything down as a foundation, and then add in the infections. And the infections are still so complicated to me. I know that if that's what I was focusing on, I could get the hang of it. But just, from an outsider's viewpoint, it's like you have to be a specialist in every field in order to do what you do. Yeah.
Yeah,
So
and I think that's the foundation of the idealism of general practitioners or primary care physicians. If
yeah,
they had that skill set with all these different things, then they could see the interconnectedness between the different systems at a base
yeah,
level, and then they could
yeah,
really truly determine when sending to that super mega specialist was necessary or not.
right,
And
right.
so, but in the complex chronic world, you have to be that because unfortunately,
Oh yeah, you have to specialize in connective tissue disorders
yeah,
and
I
mold
had to
all of a
learn a
sudden,
bunch about collagen
environmental,
disorders
and
and
it's like, yeah,
instability syndromes and Ehlers-Danlos and all kinds of stuff that I never thought I would necessarily have to know that much about. And so
yeah,
there's kind of a new idea every day it seems, or every couple months with things I have to learn more about to really understand. So it is a building process. You're
yeah,
not really expected to just learn everything overnight, but if you're competent enough in each of those systems, you can decide when you can determine better when it is necessary to send them on for higher interventional strategies,
yeah,
drugs or surgery or referral process and all that kind of thing. But you can better core manage their entire case as you understand where the interconnectedness is, because most of those specialists don't talk to each other very much, unfortunately. I've tried to
absolutely,
really mediate these discussions with some of my patients too, with their practitioners. I do a lot of peer-to-peer and stuff like that too.
yeah,
And that's
yeah,
that's actually really insightful. If you get the right person who's fairly open-minded, you can learn a bunch from them too and
yeah.
really figure it out. So yeah, it's an interesting process. There needs to be a change in general practice, I think. And I do see some systems really trying to do it, but they don't really go to the depth that they need to go in learning these systems better. So it's something we've had to largely learn ourselves or through our great mentors, so to speak.